Good morning. For part two of our series, When Doctors Don't Listen, I'm going to talk about a procedure that has become so controversial anymore in our country, in America, not in other countries, but in America especially, and it's hysterectomy. A hysterectomy is the complete removal of a woman's reproductive organs. And it's something that even when a woman who has already had as many children as she wanted to, doesn't have the right to insist on having a complete hysterectomy, which means the removal of all the reproductive organs. The cervix, the uterus, the fallopian tubes, the ovaries. A complete hysterectomy not only cures the issues the woman is having, but it also means that she is no longer a risk factor for cancers of her reproductive organs. And let me talk about that for a few seconds, because a lot of women out there, and you men who love them, you see your woman, or a woman, she goes to her OBGYN, she gets her annual exam, and everything is fine, or so they tell her, and she feels great. Here's the problem. Uterine and ovarian cancer cannot be detected early by annual OBGYN exams. In many cases, when uterine and ovarian cancer presents itself, it is already too late to cure easily. Cervical cancer, when found very, very early at the pre-cancer stage, can be cured, and a woman can go on to live a healthy life. However, in some cases, the pap smear, which detects cervical cancer early, or is supposed to, misses some cancers. I actually personally know a woman who died from cervical cancer, and while it is rare, you can go every year to get your pap smear and still be diagnosed with stage 4 cervical cancer. I went to a fundraiser several years ago of a young woman who had never missed a pap smear, but the pap smear missed her cancer when it was early enough to cure. So, first of all, we can live without our reproductive organs. We can live very nicely without them. And yet some doctors believe we can't. And they refuse to allow us to, even when we tell them we don't need them and we don't want them in our bodies. I'm going to give you 3 stories from 3 women that I personally know. All of these women, at the time of their surgeries, were in their 40s, and all 3 already had as many children as they were ever going to have. So there was no reason for any doctor to deny their wishes because they wanted more kids. They didn't. They were done. And let's remember something else that a lot of women forget. Any pregnancy over the age of 35 is considered high risk. So a doctor trying to preserve your reproductive organs so you can get pregnant after the age of 35 is putting your life in danger right there, because that is a risky pregnancy. So let's go with patient A. Patient A had endometriosis since the day she got her period, when she was a young teenager. And she was told that after she has the children she wanted to have, she should immediately have a hysterectomy because she suffered. She suffered tremendously every month, excruciating pain. And then she got irritable bowel syndrome. And doctors told her after she had her child at age 40, because, it takes a while to find the right man to be a parent with. They all said, the doctors said, now it's time for your hysterectomy. Problem was, health insurance wouldn't cover it until she went through other procedures first. So she did all that, and the doctors were still fighting. You have to have a hysterectomy. And finally, the day arrived. It's time for a hysterectomy. So she said, great, I'm so excited. I will no longer live with this pain, this constant, horrific pain. And you ladies out there, if you think your monthly cycles are bad, this is 10,000 times worse when you have endometriosis. So she went in for her surgery. She had already had her tubes tied after her child was born. So the doctors were well aware that they wanted no more children. She's 44 years old. She's waited 3 years after the birth of her son to get her hysterectomy. She wants everything taken out. And she wakes up from the anesthesia. Anesthesia is always risky, remember that. And she realizes she still has 2 ovaries. And she said to the surgeon, what? Well, your ovaries were pristine, ma'am. So we didn't remove them. That way you won't go through early menopause. What? Wait, what? See, again, the doctor didn't listen. She specifically said, take everything out, because I have had so many procedures because insurance wouldn't pay for my hysterectomy 3 years ago. I don't want to come back for surgery if I get ovarian cancer or a cyst on my ovary. But the doctor didn't listen. And you know what? All those great health benefits she was hoping for from her hysterectomy, well, they didn't really come to pass. She still has to be careful what she eats because her IBS is still acting up. And now she gets severe migraine headaches, which her doctor has told her is because she still has her ovaries. All of this, and she's 44, almost 45 now. I went through menopause when I was 45. So all of this to prevent her from going through menopause possibly a year or 2 earlier than she naturally would have. So now she still has health issues because of her reproductive organs, because the doctors refused to remove all of them. Because these doctors believe that menopause is a death knell. I'm going to talk about menopause either later today or tomorrow. I want to go to patient B. This patient had ovarian cysts. So she had her ovaries removed, or 1 ovary removed. This was after she had already had 2 healthy children in her, again, 40, 41, 42 years old. She told the doctor, look, we're not having any more kids. You're going to be in there anyway. I'm going to be under anesthesia, risky. Take it all. But he didn't. He didn't. He just took the ovary with the cyst on it and left the rest because, God forbid, you go through early menopause. 2 years later, 2 years, this woman is back in the operating room under anesthesia because her uterus dropped, causing her excruciating pain, and her uterus had to be removed. But they saved that ovary, the 1 healthy ovary. Doctors don't listen. This woman still has to go for annual exams at the gynecologist because she's got an ovary that could cause cancer. And yet she has had 2 reproductive surgeries on her reproductive organs. Neither one yielding the result she requested when she consulted with the surgeon, because the surgeon made a decision for her. Patient C is the same situation. She had fibroid tumors like my mother had. They removed the uterus, they kept everything else. This woman was not having any more children. In fact, she can't have children of her own. She's infertile. The doctors knew this. God forbid she go through early menopause, again, in her 40s. Doctors don't listen. And it seems the only doctors that actually don't listen are the ones who deal with our reproductive organs. Which, unless we want children, we don't need them. And I'm going to talk to you about menopause. I think menopause is a state of mind. Because women in our society, this society that is so obsessed with babies and pregnancies and getting pregnant and women willing to risk their lives to get pregnant and even bring into this world severely disabled children. We've lost something here because we have now started shaming women who can't have children, making them feel like they're less than, making them feel inadequate. Like if you get a hysterectomy because you are in pain and you're suffering at 30 years old and you can no longer procreate the old-fashioned way, something is wrong. You should be ashamed. You should feel terrible. You should be depressed. Sounds like The Handmaid's Tale, which we're going to discuss. I'm waiting for the new book to come out about the philosophy of The Handmaid's Tale. But this is the problem. That society shames women who can't have children and tries to put women who don't want to have children in a closet. We're terrible, horrible people. We're selfish. We're heartless. We hate kids. We have to hide behind closed Facebook groups to profess that we are happily child-free. Menopause isn't that bad. And you don't need the hormone replacement therapy, which, by the way, like birth control, can cause cancer. I didn't need it. I went through menopause, yeah. I got a little overheated. And I've always been moody, so the mood swings, nothing new. Menopause doesn't kill you. Menopause doesn't mean you gotta use the chemo and lose your hair and get mouth sores and vomit. And yet these doctors who leave these unnecessary and useless organs, by the way, once your uterus is pulled out, guess what? You're not having any kids. So what good are your ovaries? Well, you won't go through menopause. Great, now I'm going to go through ovarian cancer. You see my issue. I would love it if there is anyone out here listening to this show today that is either a doctor or a medical person who knows what can answer this question for me. Why? Why is menopause so appalling to you doctors? Why is early menopause so appalling to you doctors? That you would risk a patient going under extensive other surgeries in the future, getting under anesthesia, which is why many patients die, by the way. Most complications from surgery is caused by a bad reaction to anesthesia. So the more anesthesia you go through in your lifetime, the more chance you have of dying. What is the big deal? Do you know that gallbladder surgery is also an appendectomy in like 90% of gallbladder surgeries? See, whoever built our bodies, whether you believe it's God or evolution, there are organs in our bodies that we actually don't need to live a healthy, normal life. Gallbladder is one of them, and a lot of people have their gallbladders out. It's a very normal surgery. But while the doctors are in there, the gallbladder and the appendix are close together. When my mother had her gallbladder out, they took her appendix as well. You know why? Because they said, you don't need your appendix. We're going to be there anyway. You're under anesthesia. Let's get rid of the appendix so you never have to worry about that again. We won't have to see you back here risking your life going under anesthesia for appendicitis, which can kill you, by the way. I have a cousin whose appendix burst and she almost died. Thankfully, she didn't. So when they do gallbladder, they grab the appendix too. Why, if you're taking out a uterus, would you not grab the ovaries too? Or if you're taking out the ovaries, why not grab the uterus and the cervix too? I don't understand the reasoning behind this, especially when your patient has looked you in the eye, fascia e fascia, and said, take it all. Because I'm not going to be back here 2, 3, 10 years from now going under the knife again. I have a theory. It's a conspiracy theory, but I do wonder. I mean, think about it. Back when I was 41, I had a bad pap smear. And because of the way I was being treated by Planned Parenthood, I've been open about this, I was like, fuck this. I don't want children. I don't need my cervix. I don't need my reproductive organs. I said, maybe this is the chance for me to just get a hysterectomy and get it done, get off the birth control. Now, it did turn out that my bad pap smear was a lab mistake, which, again, they didn't want to admit. However, I found a great friend of ours and a viewer, Shari. She grew up in Puerto Rico. She said, there is a wonderful doctor in Puerto Rico. She gave me his email address, and I emailed this man. And this is Puerto Rico. This isn't Guatemala or Mexico or where they practice voodoo. This is an American state, an American entity. And this doctor, world-renowned, by the way, great reviews, for $5,000, he will perform a complete hysterectomy on any woman who does not want children and has a dire fear of reproductive cancers, such as ovarian, uterine, and cervical. No questions asked. Fly to Puerto Rico, pay him $5,000, you get the hysterectomy, complete, no questions asked. So why are U.S. doctors here on the mainland so afraid to take it all out? Especially when, as I have said, the surgery they're performing will make the woman unable to ever birth a child the old-fashioned way anyhow. Why not take it all, like they do with the gallbladder? They remove a perfectly healthy appendix when they go in for your gallbladder. Not because there's anything wrong with it, but because you don't need it. And why have you come back? I submit to you, the doctors who perform reproductive organ surgery, they want you to come back. They want repeat business. They also don't want you to stop coming to the OBGYN because that would make them lose business. If you don't have any reproductive organs, there's no reason to go to the OBGYN for your annual exam. $200 and some in their pocket. But if you have your ovaries or you have your uterus, you still have to go. Maybe I'm a conspiracy theorist. Maybe I've got something here. Maybe their pharmaceutical friends say, oh, leave the ovaries, because if they get ovarian cancer, we get to sell them our chemotherapy drugs and our drugs to stop the nausea from chemotherapy and all the other stuff, the ways that pharmaceutical companies make their money off of others suffering from cancer. When did night sweats, mood swings, maybe a little weight gain, maybe a little weight loss, maybe some breast discomfort, when did that become worse than cancer? Because that's what these doctors tell women. You don't want to go through the menopause. Not till you're ready. Not till you're 50, 60 years old. You don't want to go through the menopause early. That's why we left your ovaries. Oh, and the patient A, your ovaries were pristine. I couldn't take them out. Why? They might be pristine, but they're not doing me any good because I don't have a uterus. Guess what? They don't work anymore. They don't give me anything. Why didn't you take them out? Because they were pristine. Then why do they remove pristine appendixes when they remove a gallbladder? Can you answer me that question? Can anybody give me a logical explanation that as a woman, when I look a doctor in the face and say, I'm going to go under anesthesia next week, and I'm only going to do it once. So you take every fucking thing out. I'm sorry I'm dropping the F-bomb, but this makes me so angry. Angry, angry, angry. I swear to God, if a man walked into a doctor's office with the same organs and said, get them all out, they'd be all out. Congratulations, sir. You never have to see your OBGYN again. But they won't do it for a woman. And this is not about procreation. Because once a woman has her reproductive organs, any one or two of them removed, she can no longer carry a baby. And most of these women don't want to. So what is the problem? Why is it so horrible to remove the reproductive organs of a woman as opposed to leaving some in so in a couple years she can come back, go under the knife again, only this time it's life-threatening, it's cancer, it's chemotherapy, it's radiation. And make no mistake about this, annual exams at an OBGYN do not detect ovarian and uterine cancer at its earliest curable stages. So don't feel good if you don't have your cervix anymore, if you don't have your ovaries, your uterus is there, or if your uterus is gone and your ovaries are there, they're not going to catch your cancer early. Not just by feeling around. And most women don't get annual ultrasounds on their ovaries and their uterus, which is the only way, by the way, to detect ovarian uterine cancer at its earliest, most curable stage. Most women who have ovarian and uterine cancer die within 5 years. Those who live 5 years, it usually recurs. By the time many women are diagnosed with ovarian cancer, it's not operable, which means the only treatment is chemo. We know chemo is poison. So think about this. And please, I can't wait to hear comments. And if anyone in the medical community would like to explain themselves to me, a woman who still has all her reproductive organs and worries about them constantly, please explain to me why women continue to suffer even after a surgery that was supposed to cure what was wrong with them in the first place. And yet they still suffer from migraine headaches. They still have to go for annual exams. They still have to watch what they eat. Some of them still get periods, for God's sake, even though they wanted everything taken out, so they won't have to deal with this anymore. And not one of the women in my story is trying to get pregnant, wants to get pregnant. Most of them already had their tubes tied so they can't even get pregnant, or their husbands had vasectomies. This isn't about a woman continuing to be fertile. It's about a woman signing up for surgery, major surgery, expecting to wake up cured. and instead wakes up with leftovers, things left in her body she expected to be gone because a doctor didn't listen. Tomorrow, I'm going to share with you a story that is going to blow your mind because it blew mine. So please stay tuned tomorrow. Political Paula is out.